Hi, my name is Brooke Bixler, and today I'm going to be sharing my informative speech with you today. My topic is on intrahepatic cholangiocarcinoma. Imagine having a 53-year-old mother who was diagnosed with this horrible disease. What is it? Well, intrahepatic cholangiocarcinoma is a type of bile duct cancer. As we do not always look for health issues, it is important to stay up to date on all screenings that should be done after a certain age, most of the time after the age of 50. Other screenings can be after the age of 40. I know my mother had rectal cancer and liver cancer. And I know now that I will have to get my screenings done at an earlier age. I'm going to be talking about the disease and the statistics of intrahepatic cholangiocarcinoma. I will go over where the cancer originated, the statistics, and the prognosis and treatment as well. Let's talk about the word cholangiocarcinoma. So first and foremost, cholangiocarcinomas are a group of tumors that start in the biliary tract within the liver and bile ducts. Most of the time, these cancers are pretty hard to diagnose because the origination of the disease is often not studied. Usually, cholangiocarcinomas do not cause any symptoms in early stages, and the cancer itself is usually not diagnosed until it has spread to the bile ducts or other tissues of the body. I'm going to show you guys a picture of what my mom looks like. Now, this was in March of 2021. This was at my wedding. This is her right here. That's my sister in the background. She was singing a song for the mother-daughter dance. And just a couple months later, we lost her to cancer. And this cancer specifically. So in this disease, the most common symptoms include jaundice because this cancer, number one, is attacking the liver. So whenever the liver is not functioning properly, a lot of people with this tend to get yellow in the skin. And even the whites of the eyes can turn yellow as well. Other symptoms of this cancer can include fatigue, itching, dark-colored urine, loss of appetite, unintentional weight loss, abdominal pain, and irregular stools. Cholangiocarcinomas can be divided into two types. The one I'm talking about today is intrahepatic. There's also another one known as ductal. When talking about cholangiocarcinoma, it's important to know that these tumors do start in the extrahepatic biliary tree and larger intrahepatic bile ducts, which do originate from PBGs or the surface of epithelium of corresponding ducts. For an example, I was reading an article about cholangiocarcinoma, and I have it on my note card here. It was about treatments with this cancer and the prognosis as well. So the median ages ranged from 49 to 67 years old, and 57% of those patients were males. Most patients had a solitary 69% large tumor of the mass-forming type, which was a total of 86%. The median 5-year overall survival rate was approximately 28 months, which was only about 30% of patients. The prognosis of intrahepatic cholangiocarcinoma is determined mainly by tumor factors. Another article that I read shows data that 15,751 patients diagnosed with this were extracted to analyze the rate of the cancer metastasizing. The metastasizing was more common in the extrahepatic cholangiocarcinoma compared to intrahepatic cholangiocarcinoma. And the percentages were 42.62% versus 31.46%. Surgery is a potential option for this kind of cancer. However, most patients, nearly 70%, are diagnosed at a late stage due to not having any symptoms, which I had talked about earlier. Like my mother, when the disease is unresectable, only palliative or hospice care is possible. So after reading about the statistics that I had found in those articles, I'm sure you're probably wondering whether or not this is genetic. So in another article that I had found, research does state that cholangiocarcinomas are not inherited. Studies suggest that blood relatives of a person with any type of this cancer may have an increased risk of developing a liver cancer compared to the normal population of people. Most people with cholangiocarcinoma do not have a family history of this disease. For example, my mother did not. I'm just going to show you guys another picture here of my mom and I. This again is me and my mom at my wedding. She was going through a lot at that time. A lot of scans she had to get done. She would have to get her belly drained because extra fluid. And there was just a lot going on with this kind of cancer. She was diagnosed at the beginning of 2019. She had her liver resected, and then when she went for her 6-month scan, tumors had appeared again in her liver. And she didn't have the option of like a liver transplant or anything like that because the tumors had spread so much. At that point, there wasn't really an option for any kind of treatment except, in the end, hospice care. Intrahepatic cholangiocarcinoma is usually diagnosed by laboratory tests. So this would include like liver and gallbladder function tests to measure the amount of bilirubin, albumin, liver enzymes, and other things that are in the blood. There's also more tests that can detect the presence of tumor markers. This would include like x-rays, CT scans, ultrasounds, MRIs. There is another procedure that I found. It's known as cholangiography. And this produces images of the bile ducts that can show blockages, narrowing and dilation, which are all signs of cholangiocarcinoma. So today we have looked at, I have talked to you about what intrahepatic cholangiocarcinoma is. We talked about where it was originated, the statistics, the treatment, and the prognosis. I do encourage you, whether you're younger and older or older in age, to get the screenings that you're supposed to. So whether or not this includes prostate exams, mammograms, rectal exams, whatever it may be, get them done because you never know what is going on in your body. Also try to stay up to date on your family history. Talk to your parents, your grandparents, your aunts and uncles, and get their family history so that when you get older, you know what you're looking for. Look for signs and symptoms that you may be having, not only with this disease, but for other diseases, because you never know. So now that you have more information about this disease, you know what to look for if you have any kinds of concerns. So that is all I have for today. Thank you.